I was really handling morning sickness all wrong, and that there were a lot of things I could have done to make that be a lot better. So today we're going to talk about the most important thing you need to be doing to manage morning sickness, and a whole lot of other things you can try to make it better and give you extra relief and take that edge off so that you can get through this phase feeling pretty decent, maybe even great, depending on how severe of a situation you're dealing with in the first place, and have the best pregnancy possible. During my first pregnancy, morning sickness hit me so hard that I was throwing up all day long. I had to excuse myself at work constantly. Any smell made me sick, it made me gag. I couldn't keep water down, couldn't keep food down. I felt miserable and horrible all day long. Pulling over to the side of the road to have to throw up, it was just really, really bad. And the saddest part is that later I learned that I was really handling morning sickness all wrong, and that there were a lot of things I could have done to make that be a lot better. Gratefully, I had 7 more pregnancies that were not nearly as bad. They were still pretty miserable during the morning sickness phase, but the things that we're going to talk about really gave a lot of relief. Sometimes it'd just be for a few hours that still felt so good. Sometimes I'd feel great for several days at a time. And generally the level of morning sickness just wasn't anywhere near as severe as it had been during that first pregnancy. So today we're going to talk about the most important thing you need to be doing to manage morning sickness, and a whole lot of other things you can try to make it better and give you extra relief and take that edge off so that you can get through this phase feeling pretty decent, maybe even great, depending on how severe of a situation you're dealing with in the first place, and have the best pregnancy possible. My name is Rachel Moises. I am a mother of 8, and I'm excited here to share with you everything that I've learned about morning sickness and how to get through this very horrible part of pregnancy as best you can.
And my name is Heather Shelley. I am a family nurse practitioner, a licensed midwife, and a board-certified lactation consultant. And I'm excited to tell you because, like you, I had miserable morning sickness in my pregnancies.
It's so hard. If you're going through it right now, which you probably are if you're watching this video, just know that you can get through it better. If you haven't been doing much, we're going to share a ton of tips that you can try that can really make a difference, even though we're not promising you it's going to be completely gone until you just get through that stage of your pregnancy. But these things are going to help you get through so much better.
Right. We're going to give you a lot of suggestions because something doesn't work for every single person. You've got to try and see what works for you, because there are so many different causes of morning sickness, right, besides being pregnant, of course.
Right. Okay, so I want to share my story about my first pregnancy. It was the worst as far as morning sickness goes, and that's because, frankly, I didn't handle it well. I didn't know how to deal with morning sickness. So with that pregnancy, I was sick all day long, just throwing up throughout the whole day, usually every few hours. And the reason that I later learned, gratefully, because I had 7 more pregnancies, that the thing that made it the worst was that I was just not really eating, because I was used to, any time before that I had dealt with nausea, it was from a stomach bug, just from being sick for a few days, in which case you usually just don't eat for a few days until that you get over it and you start feeling better. But morning sickness lasts several months. You can't just not eat.
Right.
So that's how I was handling the morning sickness. I felt sick, so I didn't want to eat. So I didn't eat, and that actually made it a lot worse. So kind of tip number 1 is eat all the time, which is so hard because you don't want to eat, right? Like, you have food aversions, you feel sick. For me, I lose appetite in that first part of my pregnancy, and then I have to be forcing myself to eat every 2 to 3 hours, no matter how busy you are, no matter what you've got going on. You just stop and eat. It's hard, but it is really, really worth it because it makes such a big difference. Do you know why?
Well, and it's snacking. It's not a full meal. It's little tiny snacks. Mm-hmm. Some people it's carbohydrates. Some people it's protein. And because some people have this because of low blood sugar levels. And so the carbohydrates will help bring that up, and then protein will help stabilize that. So that's one of the suggestions. That's why they say put crackers by your bed, so that when you wake up first thing, you can eat a couple crackers. They're easily digestible, and they give you the carbohydrates. You can get up, get moving, and then have some protein.
Okay, that's a really good point, because I have heard some people say it has to all be like high protein snacks.
Right. And some people it's carbs. You have to experiment and see what works for you. Does the protein work better for you? Do the carbs work better for you? And one thing that works for somebody else, you can't stand the smell of, you can't stand the taste of. I remember with my morning sickness, with all my pregnancies, I had to smell everything before I could eat it. And if it made me gag and dry heave, I had to find something that I could eat that didn't make me gag from the smell.
So if anyone's telling you this one thing is the way to solve morning sickness, or you have to do it this way, you have to do that way,
Try it,
but don't get discouraged if it doesn't work for you.
Right.
Because like even for me, over the course of my different pregnancies, there wasn't one thing that worked for every single one of them.
Exactly.
So it's not even just woman to woman, it could be pregnancy to pregnancy. And that's why we're talking about so many different things for you to try, because unfortunately you might have to try multiple things before you find, oh, this is what's giving me relief and this is what's working for me. Although the eating frequent meals will make a difference for everyone. Can I confidently say that?
Yes, they just may be very small. I like to call them more snacks.
Okay, eating frequently.
Yes.
Meals feels more overwhelming and
Yes,
intimidating.
like a lot of food.
Yeah,
exactly.
Okay. So do that. That should be your baseline. Like eat all the time, even though you don't feel like it. I know that for me, I learned that if I would start feeling nauseated, I would start eating really slowly, even though I really didn't feel like it, because I felt like I was going to throw up. But usually if I would eat slowly, it would help dissipate the nausea enough that I could keep the food down. And if not, if it came back up, you kind of reset, oh well. But I'd say that most often it would help. Just that
I
go
found
away.
that things that were very easily digestible was a big one, because it could pass through my stomach quickly rather than meat. Meat would sit there. And so things that could go through quickly, things that did not have strong odors or a strong taste to them, and cold. Those were things that really helped me, like lemonade. The coldness of the lemonade, for some reason, cold really worked for me.
Okay, that is good to know. Like she said, it is experimenting, and we don't want to overkill that, but
Right.
I learned that the smell of garlic is something I love. If you have fresh garlic bread cooking or cooking anything with garlic, I love that smell. But it would make me throw up within seconds of smelling it when I'm pregnant, every single pregnancy. So you do kind of have to learn, and you will learn, because that's unavoidable to learn
And you'll
stuff
think,
like that.
I love this. This
Yeah.
is my favorite food. I could not say the word chicken, let alone look at a chicken or eat a chicken. I could not say the word without dry heaving.
Okay.
You
don't know what's going to happen to you. So let's move along. Along with experimenting, you might need to, I guess the point we're making here is you might need to leave some things out of your diet. Maybe dairy is upsetting you and you're used to having it, but you got to go without. Then that's all about just kind of seeing.
And dairy can be a trigger for some people. Mm-hmm. It can have, it can slow the digestion. And for some people, the proteins in dairy can really upset their morning sickness.
Okay, that's good to know. Okay, let's talk about some natural remedies, just things that you can actively try to see if that calms the nausea.
So some of the things that can help people are ginger. You're not supposed to eat a lot of ginger in pregnancy, but having the ginger chews, a little bit of ginger tea, that kind of refreshing taste of ginger can really help some people. It works good for motion sickness. And so where morning sickness feels a lot like motion sickness, for people who have a mild case of it, the ginger can really help. Right. So that's one of the suggestions that.
And I just want to point out these things, if you're doing good about eating your frequent snacks to kind of keep things at a decent baseline where your nausea is not just out of control, then this is another layer that really helps bring it down to where you feel a lot more comfortable.
Right.
Another one is peppermint.
Yes. And the smell of it.
Yeah. So that's what I noticed with one of my pregnancies. I was super amazed by this. My mother-in-law had a peppermint plant or just a mint plant in her yard. And I got the leaves and I just rubbed them and smelled them. I was amazed that it actually made me feel a lot better. You can also use peppermint oil or just peppermint tea, but it's worth a try because it really did. And ginger sometimes helped me and sometimes didn't.
Right. Papaya and pineapple, they both have bromelain in them. They can help with digestion so that food doesn't kind of sit there, because one thing that happens is in pregnancy, we release a hormone called relaxin. And relaxin is to help in the birth, to help our hips move and our bones move. But the body doesn't say, oh, I'm just going to send relaxin to the hips in the last, month.
Right.
It goes everywhere. And so our digestion slows down a lot. And that means that food is going to sit in our stomachs. And so if we can eat foods that help with digestion, then we can get that food out of our stomach faster, into our intestines, where we can absorb the nutrients and not throw it up.
So what do you think about taking digestive enzymes? Have you seen that helps?
If you can do that, that can really help, taking the digestive enzymes. And you're going to have to find the ones that work for you. There are some that are pretty powerful that you have to take in a capsule form. You can't chew. And then there are some like papaya enzymes and stuff that you can chew. Usually the ones you chew are not as potent, but that may be what you can handle, because you can't handle drinking a bunch of water to swallow a pill. So it's experimenting. So acupressure can really help some people. Have you seen the wristbands that they on boats?
I've tried them.
Yeah,
didn't really make a difference for me, but I've heard that it does for some people.
I think for the standard, I'm not really throwing up, I'm just nauseous throughout the day. Those C-bands can really help. But if you are having it where you are throwing up multiple times a day, they probably won't do much. But they can work for the woman who just has that mild morning sickness. Like I said, just that nausea. We don't have throwing up happening.
Well, I feel like when you're in the throes of morning sickness, any little bit of relief, anything that can take the edge, make it feel better for a little while.
Yeah.
Or because a lot of these things, for example, the ginger chews, the peppermint tea, unless you're going to be drinking peppermint tea all day long, it's usually just like, I really need some relief right now, so I'm going to drink it. Maybe some people get in the habit of just sipping on that all day. I guess I wasn't dedicated enough. It was more like when I was just like, okay, I really need some relief here type of a thing. But but it's nice to have enough things that can all make just a little bit of a relief, and then combined, it feels like you can get through it a lot easier. I don't know.
All right, so some of the things that we should be doing when we're pregnant can actually make morning sickness worse. And one thing that I tell the women that come to me is I say, you just have to survive through the first part of morning sickness, because most women only have morning sickness for 12 to 14 weeks. There's not many women that go beyond that. And typically, if you go beyond that pretty severe, it's more of a hyperemesis kind of thing. But most women just survive that first trimester as best you can. So some of the things that we should be doing that can make it worse, that we have to kind of put on hold, are prenatal vitamins. What makes a prenatal is the amount of folate in it and iron can be upsetting to the stomach. And so you can try to take your prenatal at night. Try different prenatals. I tell people, instead of taking a prenatal that you just take once a day, try getting a prenatal that is a soft gel capsule that you take multiple times a day, because those are usually less intense on the stomach. You're supposed to take them without food. That's not going to happen when you have morning sickness. You have to have a little bit of something on your stomach, and that's okay. So once again, you're experimenting. Can I take my prenatals right now? Do I need to change brands? You just got to work with it.
I know that you recommend Floridix to your patients. You recommend it to me, and I still use it as my #1 favorite iron supplement. Is that a little bit easier on?
Some people don't mind the taste of it, and that works for them, and other people can't. Hemaplex is another one that I recommend to moms. There's chewables, there's tablets, there's capsules, they have multiple different, there's the liquid form. And I tell moms, sometimes you just have to try one. If that doesn't work, you try another one. And hopefully you're not anemic. It's really nice if you can just not be anemic.
Yeah, I was going to say, do you have to take iron during that time? Can you just kind of be like, I'm not going to take it for a couple months and then I'll ramp up after that?
Really interesting, in the United States and Canada, prenatals always have iron in them. But if you go to other parts of the world, like New Zealand, they always have iodine, and they only take iron if it is recommended. Where here, we take iron all the time, and we only do iodine if it's recommended, meaning that your blood work shows it's needed. So different parts of the world, and that's because of diets, because of elevation. For instance, if you live at a higher elevation, you need a higher hematocrit and hemoglobin, which means you need more iron. Where if you live at sea level, you don't need quite as high of a hematocrit and hemoglobin. So iron isn't as big of a deal.
So what should someone do if she feels like, I definitely think that my iron supplement or my prenatal is making me sick.
Right.
And she's tried a couple, they've all got iron, and she's just still like, no, I see a correlation. Like, I think it's doing, can she just stop? Should she get her iron checked?
I mean, definitely get your iron checked so that you know what you truly need for your blood work, for your health. But some other things that you can do are chlorophyll. There are chlorophyll chewables with mint flavored. Chlorophyll liquid, it tastes like grass or minty grass. And I dilute it with cranberry juice or orange juice because vitamin C helps iron absorb. Cooking in cast iron pans, like camping pans, cast iron pans work really, really well. And dark leafy greens. And combine those dark leafy greens with vitamin C. And that can be an actual supplement of vitamin C or the orange juice or, different foods that help it, because that helps the iron absorption. And that's kind of a way to get around iron pills until you get to the point where you can supplement. The type of iron pills makes a difference, not just the brand, but if you're doing ferrous sulfate, that's going to cause nausea, constipation, a lot of different issues, but it's cheap. And that's why it's recommended. Where if you are willing to spend a little bit more money and get like iron gluconate, iron citrate, those are gentler on the stomach and don't cause the constipation.
Okay, which you can already be struggling with if you're also dealing with morning sickness a lot of times. Like you said, your whole system just kind of goes slower.
Yep,
yeah,
exactly.
Okay, that's good to know.
So those are some ways around some of that supplementation. And then B6 is really good. Combining B6 with half a Unisom, not super Unisom or overnight, but you want just plain Unisom. Talk to your doctor, of course, talk to your midwife, make sure it's okay for you. But B6 and half a Unisom at night, it doesn't help that day, it helps for the next day. It's a very common one. That's basically in prescription form diclegis or diclectin, depending if you're in the United States or Canada, what it's called. But that's kind of the compounding that you can make yourself. B6 is also really good because when we are stressed, we deplete our B6 stores. Well, what does pregnancy do to our body? It stresses us. And now I'm throwing up, so now I'm really stressed. And I'm losing weight, so I'm really stressed. And the B6 is just being depleted like crazy. We put that back in, and it can really help with a lot of women.
Okay, that's good to try.
So one thing is don't skip, because you'll think, oh, I had a great day today. I don't need to take it tonight. And then the next day, you're throwing up. It starts all over again.
Right.
So watch that one.
Good tip.
Another thing that you can do is magnesium. There's a lot of good research that is coming out that women that are deficient in magnesium are having a difficult time with severe morning sickness. And magnesium relaxes our muscles. It helps with our mental relaxation, the calming as well. There's a lot of different types of magnesium. There's magnesium glycinate, just like iron, a lot of different types. There's about 6 forms, I believe, of magnesium. And using magnesium, starting with 200 to 400 milligrams a day and working up, that can really helps. Some women, if you are not pregnant yet, but you're thinking of becoming pregnant, doing a liver cleanse can really help. Don't do that while pregnant, okay? You can do liver support when you're pregnant, but don't do a liver cleanse. But a liver is where all of our toxins are kept. And so there is a theory, because remember, we don't know exactly why morning sickness happens, is doing that cleanse can help take those toxins out of your liver. Because when you are pregnant, your liver is it has a hard time because it's detoxing for 2 people now. And if you can do that liver cleanse and get your vitamins, your magnesium, your calcium, get everything up and your body nourished, they're finding those women have a much, much easier time with morning sickness.
Okay.
It goes down a lot.
But if you're already pregnant, it's just take the supplements that we're talking about and do the best you can with that.
Right.
So you said, I think start with 200 milligrams of magnesium and go up. How high typically can you go up?
Usually your bowels will kind of tell you. Because when I have moms that are constipated, for instance, I will have them take 1,000 milligrams in the morning to see if it will move their bowels. And so if you're starting to get diarrhea, back off.
Oh, okay.
Yeah.
All right. And with all of these supplements and everything, you want to check with your healthcare provider first.
Exactly.
Because we don't know what your particular
health is.
Yeah.
Yeah, exactly.
Okay. So what about prescriptions?
Yes.
I did not try them until I think my 6th pregnancy, because I think you just said, so Heather was my midwife, by the way, if you don't know that. I think you just suggested it, and I was like, well, I don't know, I never thought about that. I thought you had to be like almost dying to take a prescription for nausea. And for my 6th pregnancy, I took one that helped a ton, and it was really, really awesome. So my 7th pregnancy, the day I found out I was pregnant, I contacted you and said I need a prescription. But unfortunately, that one, I think it was the same one, but it just was having side effects that time that I couldn't handle, and I was not able to find a good prescription. I, for some reason, was having more side effects for my last 2 pregnancies. But the one when the prescription worked, it was amazing. For sure my preferred situation. It was so nice.
So there are multiple prescriptions out there. There's the diclegis or diclectin, which is the B6 and Unisom compounded. That one can be pretty expensive, so depending on your insurance and what it covers. There is Zofran, or the generic is ondansetron. That is a very common one that is used for morning sickness. It does cause constipation when taken quite regularly, and so you have to make sure your bowels are moving and that you're not having rabbit pellets.
Right.
Another one that some people, there are a few others that you can talk to your provider about. When those should be started are typically women who are having morning sickness beyond 14 weeks. And I'm not talking just I'm a little nauseous, but you are really struggling. You're throwing up multiple times a week. Or you are losing a substantial amount of weight. And substantial is comparative to where you started. So that can make the difference, because if you don't get on top of morning sickness, you can have a miscarriage. And I'm not, like I said, I'm not talking mild morning sickness. I am talking somebody who is throwing up their entire pregnancy. They started out at, let's say hypothetically, 140 pounds, and they are now 20 weeks and they're 3 pounds under because they lost so much weight. I remember walking in, because I wasn't a midwife at the time, my 2nd or 3rd pregnancy, I can't remember. I was with a midwife, but she couldn't do prescriptions because she was a direct entry midwife, not a certified nurse midwife. And I'd lost 13 pounds already my first trimester. And I went into the doctor and he said, oh, you're 12 weeks. Morning sickness stops at 12 weeks. And I was like, okay, first, I throw up for 38 weeks. Okay, like we're doing this. Okay, this is not going away at 12 weeks, right? Yeah. And I said, and I have lost almost 15 pounds. I'm not leaving your office until I get a prescription. And he gave it to me. He was a little grouchy about it, but advocating for yourself can really, it's important because you'll get that spiral spin and you'll just get worse and worse and worse. When I have women who need IV therapy because they're throwing up water, they just can't keep anything down. The emergency room is nice, okay? Because they'll give you an IV, they'll give you some Zofran inside of your IV typically, but that's all they're gonna give you. When moms come to me, I'm giving them, in my office, I'm giving them vitamin C in the IV, B12, B6, magnesium, because they need those. And I say, do not wait until you are weak and lethargic. You come back in and get another one. And for women that need 2 or 3 a week, and just fluids, I don't give them vitamins that many times a week, but we do home therapy for them. Because what we found is, once again, that your miscarriage rate goes down and you will have a healthier pregnancy. The placenta will be healthier, baby will be healthier, you'll be healthier if you can get out of that tailspin of being so sick.
So how does a woman decide, well, oh, I think I'm bad enough, I need to do that, or maybe I can just, I guess to begin with, I would say try some other stuff first that we've talked about, and if it's like nothing is making a difference, nothing's helping.
Well, like I said, if you are going past 14 weeks with severe nausea or with throwing up, and if you are losing weight, if you just lose a couple pounds the first trimester, I'm not too worried. But if you're losing 10, 15 pounds that first trimester, we need to get you on medication. We need to start IV fluids and get those things flowing. I remember for me, I took Zofran with all my pregnancies. And there was research about 20 years ago saying, oh, we think Zofran might have these side effects. But the Dutch, I believe it was, did a huge study of about 600,000 women. Oh. And they were looking for, okay, what are the heart birth defects? You know, can we prove these small studies? And what they found is the heart defect rate was the same in both groups of women that took it and did not take it. Mm-hmm. So they said, okay, that can't be the cause. But as I said, the miscarriage rate went down substantially in the group that took the Zofran.
Oh, okay.
And so, and it wasn't a magic pill for me. Sometimes it just took the edge off. Mm-hmm. And sometimes it was like my stomach woke up and I was like, take me for steak. Mm-hmm. I want food so badly. And those were the nights that we went out. My husband, we just loaded up the kids and we went out because I could finally eat and I needed protein.
So good to have that relief, the contrast. I do feel that morning sickness gave me some empathy for people who have chronic illness because it's so hard. And let's talk about it for just a second, is the emotional toll. It's really difficult to feel sick all day long, all night long. And then on top of it, if you have other children already and you're trying to take care of them and your house, sometimes you're working as well. And it's just, you feel like you have to keep going. Life can't just stop for 3 months. But at the same time, all you really want to do is lie down, you know? And it's so hard. Everything is so much more difficult. Throw in if you don't have a supportive partner, it's that much more difficult. It really does start to feel like this is just too much. I can't handle it.
And it's frustrating because many doctors won't even, and midwives not so much. That's why I say doctors. Many doctors won't even see you till 12 weeks. They're like, okay, your risk of miscarriage is greatly reduced if you can hit 12 weeks of pregnancy. I don't even want to see you. Meanwhile, you're puking. You know, you're throwing up every day, yet your provider won't see you. And so one thing, we do free meet and greets at our clinic where you can come in, get a tour, talk to me, ask questions. I can ask you questions. And one thing that women ask me, they say, when should I have my first appointment? And I say, well, around 10 or 12 weeks is when we can hear heart tones quite easily. But if you have morning sickness and it's becoming concerning, get in right away. Do not wait. And for women like us that have had children before, I say, if you know you have morning sickness, come in before the morning sickness starts. It's usually about 6 weeks is when it starts. Mm-hmm. So get in right away so that I can call you in a prescription, because I can't do that until you're an established patient of mine. Right. So get established, and the moment that morning sickness hits, what has worked for you in the past, we can get that going so that we can get on top of it, so that you can have a healthier pregnancy this time.
Yeah. So you've mentioned several times getting on top of it, and I just want to make sure everyone understands sort of the spiral.
Right.
If you are feeling nauseated, and so a lot of times you can't keep water down.
Right.
And that's or you can't drink a lot of water. I know that happened to me. Like water would make me throw up.
I was the same way. I had to do lemonade.
Yeah,
homemade
or
lemonade.
Emergency.
What's that called? Yep.
That helps.
I had to find something to put in the water because I couldn't handle the flavor.
Yeah, plain water.
Plain water.
So weird because that's all I ever drink normally.
Right.
So then you start to get dehydrated. Dehydration increases nausea. Then you start depleting all of these nutrients because you're not eating enough. Or you're throwing up what you do eat, so then that just makes it worse. So this is what we're talking about, is the compounding effect, to where you can't get any relief and you're so bad that you're just not being able to keep anything out. Like, that's really what happened with my first pregnancy. I didn't do anything proactively to help with my morning sickness, and my doctor didn't say anything to me. Like, he knew I was throwing up all the time. It's just like, oh, you'll get through it, you know. And I wish, I'm a little annoyed because had I been more educated, I would have, you know, done something personally, and maybe, you know, and said, I think I need a prescription. That would help me just get more on top of it and whatever. But the point is, don't treat it like, oh, I'm being a wimp because I feel so sick.
And don't let your provider do that. So,
or your husband.
They used to say,
sorry, but I got to say it. I've seen it.
I have known women that changed from doctors to my care because they told me it was in my head. they told me, oh, honey, it's just in your head. Just buck it up and you'll be fine. And when you have to advocate for yourself and say, I am not fine. I cannot function. If it's getting to that point where you can't take care of your children, you can't cook dinner because the smells are upsetting you. My husband had to come home and change diapers because our older toddler, who was like 2, I couldn't change his diaper. I could change a pee diaper, but a poopy diaper, I was dry heaving so badly, and luckily we lived very close to his work, that he would come home and change the diaper because I couldn't function with it. And when you get that severe, you need a provider who will look at your electrolyte balances. They will draw your blood work if they can get it because you're so dehydrated. But it really is important because you may be low on potassium and calcium and magnesium and a lot of things that can really, those electrolytes that can really upset the balance and make it worse. And if they're just saying, oh, you'll be fine, and you're going on to 14 weeks, 16 weeks, 18 weeks, 20 weeks, I promise you, your blood work's going to be out of whack. And you need somebody who will go in and say, we need to look at this seriously because you do not want these complications in pregnancy. And it's going to deplete your body because baby is going to suck everything it can out of you. And if you don't have what baby needs, there's going to be problems.
So it's not just about you feeling better, which I think for me in my headspace, that's mostly was my concern. Like I feel so horrible, but it's also a matter of having a healthy pregnancy and a healthy baby. So I guess to sort of summarize, you've got to start with your base of eating frequently and finding out which foods to avoid and which foods make you feel better. And you've got to force yourself to do it even when you don't want to take the time, you don't feel like eating, everything sounds gross. It's just like, you have to eat anyway. Really baseline, you've got to do that. And then you can try some of the things we talked about, peppermint, ginger, all the enzymes, all the things we talked about there to see if that gives you an extra relief.
Right.
And then what did we talk about after that?
Just looking at medications.
Okay, well, that's what I was going to say.
work,
And then if you're like, nope, this is still not really, I'm not functional and this is just more than I can handle, then don't be afraid to go to your provider and say, I want to try a prescription or I want to get some blood work done or what do you recommend? But I want to do something. I can't just push through this for the rest of my thing. And don't feel like you're a wimp or you're just being dramatic or over exaggerating because like we were just saying, it's not just a matter of we want you to feel as well as you can in this pregnancy and function in your day-to-day life as well as you can, but also it's a matter of your baby's health and the safety of your baby and your body.
And it's a lot cheaper to go in and get an IV every week than it is to spend a month in the hospital because you're so dehydrated and your electrolytes are so off that now you're spending some time in the hospital because you're so sick. And we don't want you to get to that point. That's what we're trying to help you do is, okay, what can I do? And support. Support is so important so that you feel like you're not the only one, you're not drowning, and other people know what you're going through. And you can get suggestions. Someone may suggest something that you're like, I haven't tried that yet. I'm going to try that. And that was the magic ticket for you. That's what helped.
So one, not to drag this on too much, but you were talking about support. Some women don't have support, really. They're kind of like, I don't know, I got to push through. I don't have a supportive partner. I don't have really family nearby or people who I feel willing to ask for help. So if you're in that situation, it's really a matter of you've got to accept the fact that you're sort of in survival mode and getting through this phase of pregnancy. And so your house is not going to be as clean.
Exactly.
You're not going to be having really nice, wonderful, beautiful meals. You can't do as much social engagements and things. You don't worry about your yard. You just have to accept this is a time to lower my standards.
I'm growing a baby.
Yeah.
That's your job right now is growing a baby.
Identify what has to get done and I guess find a way to do it. I mean, that's speaking from personal experience. It's like you can kind of get through some stuff and get the bare minimum done, but it's okay if that's all you're getting done right now. That's totally fine.
Yeah. And the nice thing is with the internet now, you can usually find groups and mom groups or hyperemesis groups, hyperemesis being severe morning sickness, that you can turn to for support if you don't have it within arm's reach. So
for some validation.
Yes,
I'm not crazy that I'm
definitely.
going through this. So we hope that some of the things that we've said will help you try and figure out what's going to bring you the most relief and help you get through this phase of your pregnancy feeling as well as possible and staying as healthy as possible. And be sure to watch the next video where we're going to talk about glucose testing, which is not only should I do it, should I not do it, but all the things you can do to not end up having gestational diabetes and try to handle that whole situation.